Well, the first thing I need to do is lower expectations. I'm not going to tell you a lot of what you know today. I think sometimes when I go to trainings, I end up hearing a lot of things that I knew were good ideas and maybe I forgot, misplaced, wasn't doing. So I hope that is definitely a little bit about what we'll discuss today. But I'm going to go through a few things I think that are just mundane. And while I do, if you wouldn't mind, because we're going to discuss evaluation, and this really is a little bit of what I would call a type of intervention. We're having a training here. I have a pre-test in the front, or actually it's right behind, I think, your handout for the PowerPoint slides. If you wouldn't mind just taking a couple minutes while I kind of drone on about a couple of background things about logic models, which may or may not be interesting to you, but I always find that it's good to understand things from the background. If you would complete that, I would greatly appreciate it. But before that, I need you to look up here because I'm more than all that stuff that Tim just said. I'm a dad to a beautiful little girl, and wait for it, she is now a big sister as of 6 days ago. This is Esme. She was born on the 1st, New Year's baby. She was the first girl born in Boone in 2014. So, okay. So while you're filling that out, I'll just kind of talk a little bit about the overview of 3 modules that I want to put together to help build some capacity on what we're talking about and where we're going. The first module we're going to cover today really answers the what question about program evaluation. It's intended to help you communicate effectively what it is that you're doing, linking the direct services or activities at your agency to meaningful community level outcomes. The second module is really the how. So we're going to talk about actual performance measurement, how to find measures, how to link them conceptually to the intended targets that you are aiming at. And then the third module is the why, which really is focused on helping us explain to other folks using some data, using some methods about how effective our program is, why it's important to the community, and also it will be helpful to apply for external funding. So that's the kind of the broad overview. So for today, discussing logic models, briefly, just some background history. We're going to look at the stages and phases of program evaluation, which I think is important. Most of you maybe are in different stages of this process. I think it is iterative or it repeats itself continually. And we're going to talk also about social problems, specifically how we identify mediators as program targets. These are meaningful, malleable, or changeable situations related with larger problems like poverty, larger problems like diseases, community level issues. Then we're going to break down the logic model elements briefly, and hopefully have some time at the end for a little bit of application and consultation. So a logic model is and again, I'm not going to tell you all probably something that you don't know today, but indulge me for a minute. A logic model is really a flat representation of what it is that you do at your agencies or at your programs. I think that they're important for communicating to stakeholders, which are your clients, which are people that you want to obtain funding from. I think particularly important for clients. They need to know what exactly it is that agencies do. Communicates a theory of change. I think this is an acronym for a logic model. Theory of change, also called a conceptual model sometimes. It depends on who's talking. I think that's some of the confusion around logic models sometimes, and some of these concepts is there's a lot of uncommon language. And so I think one of the biggest barriers is people talk about these concepts differently. So I hope to kind of bridge some of that today. Helps list resources, inform your budget development. Actually, if a logic model is done properly, Your budget justification can follow right along with it, and you can make it clear to funders what exactly you're asking for, how it's going to be used. Organizes program activities. This is particularly important, I think, for a lot of social service agencies. So when I was a principal and I worked with a lot of low-income kids in my building, I had a lot of staff turnover. I didn't have a lot of money. Some of us don't have the resources to pay folks what they're worth. And so we see a lot of coming and going. And so staff training is important. And having some of these things organized can really facilitate training of new staff that have to come in and fill those holes when we need them. Fidelity monitoring is an important aspect of program evaluation, and I'm going to talk about that. And I think that logic model can help organize process evaluation, or what I call fidelity evaluation. We can link conceptually or visually the sequence of events that we want to see occur as outcomes. And we directly connect our program activities to what it is that we intend to change. Brief history. I'm not going to drone on about this. I like history, so I'm always looking at the history of things. I want to know why things happen. They occur for a reason. They have a whole backdrop, right? So, I started digging into this and really thinking about it, and I hadn't really looked at it until this training. I was like, where did these things start? So I started reading and looking back, and these things kind of first appeared in the 50s in research circles as a way to talk about complex ideas and how they were conceptually linked over time. A gentleman named Suchman really brought it to program or intervention research. And then really in the 1990s, the United Way of America, bless their heart. Anybody ever seen this before? Yeah, so this is, I have taught program research and evaluation for, 8 years now, and I've used this book. Is published in 1995. My students look at it still and they're like, why am I getting this antiquated book? I'm telling you, this is probably the best manual ever written on this subject. And so I use it still today. I love it. My students who are born in the age of the internet don't think it's so great. But there's another document out here by the Rand Corporation. It is similar to this document here. It is free. I'm not sure if this is free. Do you know? I'm not sure if it's free or not. I paid for it. But the Rand Corporation also has a similar kind of document that lays out the steps here. And it's really about building capacity from the ground up. I mean, grassroots kind of things, building buy-in and taking your program forward. So it's a good document to read as well if you can find it. Benefits of logic models, almost every major funder requires a logic model. It's such an easy way to communicate ideas. Even state and local, as well as private organizations, are requiring logic models more and more. All of the major federal institutes require logic models. Reason being, it really enhances clarity in how we communicate our ideas. Some of the things that we do, the social interventions that we engage in, they're complex, and we are engaging in trying to alter difficult situations through multiple ways, multiple pathways, and so we have to be able to describe that. And sometimes in narrative format, it can get very jumbled up, so logic models can help put these things together. Really helps to unpack the structure of an organization. I think it can help with fiscal orderliness. I think that if many agencies offer multiple services, do multiple activities, some of them at multiple levels, and I think that we can put together multi-element or multimodal logic models, which I'll touch upon briefly today, in order to explain these kinds of activities. And it really, as Steve was saying, helps with quality assurance. That we can establish some causal claims that we are making an impact if we are measuring and developmentally looking at some of the issues in the correct way. So, I think it's also important, one of the things that we don't look at a lot of time are process evaluation. How well are we delivering services? What is it that we can do to try to deliver them better? And how do we use that information to make mid-course corrections? So what's the problem? I'm not going to stand up here and tell you again that I'm going to tell you anything that's earth-shattering, but I will say that transition's hard, and I think that what is occurring here in this community, I think there's a zeitgeist. I think there's a great opportunity for really the kind of collaboration and partnership necessary to really create community-level change. I think the difficulty is we're living now in an environment of shrinking resources. I'm not going to sugarcoat it for you. Most of you know how difficult it is to operate on soft funding. But I think it gets even more difficult when we start talking about systems-level change, which I think is really what's happening here. That's really what we're discussing. We're discussing individual partners that are engaged in activities to create a community-level impact. I think there are a lot of language barriers, as I said before. It depends on who's talking about these things, but disciplines talk about them separately using different kinds of terminology. I oftentimes think that these things have been repackaged so many times because academics need a research agenda of their own. Drives me nuts, especially coming from education and seeing all these interventions come down the pipeline. They all look the same, but they've got different terms. It just porks teachers off. They've got to learn a whole new set of acronyms every year. I think that there's a lot of fear of appraisal of this kind of process, that if I'm not performing up to standard, will my funding be cut? I personally don't see it that way. I see it as a tool to help myself when I was a principal, a tool to help me operate a better program. That's how I choose to see it, not saying that if something isn't working, that it's not going to get cut, but if something isn't working, what am I going to do about it? And I kind of wanted to, I popped this slide in there because I got started with this whole process. So I'm a second-year professor, and I came to Columbia because I saw a lot of opportunity, and I just meeting with some people in the community, I realized that this is a place that I wanted to be because I'm interested in applying research and bridging the gap between research and practice. And I think there's a lot of possibilities here. So as part of teaching my research class, my students took 19 proposals from the United Way, and we kind of unpacked them, and we basically dissected them using a logic model and thinking about it in what I would call evidence-based practice, which is a social work term, scientifically based supports, whatever we all hear it. It comes from the medical community. Social work's been using that term for 20 years. And what I saw was about less than 15% of the proposals we looked at properly specified the problem. And I'll talk a little bit more about what I mean by that. Fewer than 26 actually proposed scientifically based supports or programs. Less than 5% linked activities, outputs, and outcomes in sequence. And less than 5% specified an accurate measurement model. And I'm not bashing this. This is difficult stuff. Don't get me wrong. I tell you what, I got up this morning and I have heard many of your names as I heard you kind of introduce yourself in here and some of the cool things that you're doing. And I'm not going to stand here and tell you that I know your business. That's not the point. I was getting dressed this morning. My wife says, "You look very nice." I was like I'm going to a funeral? She said, no, you're going to do fine. I was like, well, okay. I only raise this because this is really the fact of what I saw. And I think that all of you have the pieces and the parts in there, and all of you know this process, but I think actually putting it in boxes and laying the process out systematically, as I think we can do with the funding proposals through the United Way, will create this forum of common language and measurement across the board that will ultimately benefit you and your program. So a little constructive criticism on the proposals I saw. All right, phases and stages of program evaluation. So this is from the CDC. Ultimately, the stages of program evaluation nest within the phases of program evaluation. So to ascertain the need in a community and identify scientifically based programs are really the planning process where we do a needs assessment. What's the need for the program? Developing the evaluation design and collecting evidence is really part of the implementation process. We are doing this as part of the implementation process, and the logic model helps us lay out a plan to do that. Justifying the data and utilizing the data in policy and program decisions is really about the maintenance process. How we use the outcome as well as process information to as a feedback loop to inform what it is that we're doing. Now this looks pretty ugly. I tried to create this whole diagram while fitting the logic model in there to see how they all relate, and they do relate. And to be honest with you, it was not as ugly as I originally had. I had a bunch of feedback loops in here. But ultimately, I think that these three processes map onto the evaluation aspects, or the three groups of evaluation aspects. And I basically have drawn out how the logic model really informs each step in this process. I would say that even above this whole process is what I would call your agency's mission statement, which is a broad statement about what it is that we do, who it is that we do it for, and why. But we've got to drill down farther than that. We've got to get more specific, right? Particularly if we want to attract funding, and particularly if we want to make sure that what we're doing makes a difference. Different kinds of evaluation questions, and I don't think that this is exhaustive. But when we're planning, again, we're asking what are the service gaps, who needs them? Is there public support for the program? What do I need to operate it? Is there compliance? Once we get to the actual implementation, is there compliance, or are we operating the program with fidelity? So monitoring those outputs really answers this question. Is there increased support for the program in the community? So that's really about consumer satisfaction surveys, really. How satisfied are you with the services you're receiving? Consumer satisfaction is not an outcome. And I think it often gets confused as one. Are practitioners or end users pleased with the program? So consumer satisfaction, but also the practitioners. We know that individuals who offer a service, whether it be counseling, whether it be you name it, if they are pleased with what it is that they're doing, or they feel that some things need to change, the happier people generally are. Research shows that the more faithful they actually implement the process. The more faithful we implement the process, the more effective it is. Outcome evaluation questions are really looking at the cognitive or behavioral and even health impacts, economic impacts potentially if that is relevant to the program. Other questions that we can answer are there dosage or moderation effects. So this is really about individual differences between people. Do men versus women or boys versus girls experience a program differently? Do individuals of high income versus low income experience the program differently? And I think more important and sometimes left out of the equation here, or the question, is are there iatrogenic effects, or are there unintended consequences of what it is that we're doing? Sometimes we do things in schools with kids who have behavioral problems. There are lots of unintended problems with those interventions. We isolate those kids. We identify those kids to their peers, and that's an important developmental issue at that time period in their life, right? So let's talk about mediators. I love mediation. Defining a social problem. So I'm going to go back to one of the issues I saw with the proposals, which I didn't see the problem properly specified. When we suggest that a program addresses a huge community level or population level issue like poverty or teen pregnancy, drug abuse, aggression, that belongs in the mission statement. It does not belong in the measurement or how it is that we talk about a program. Really, the problem statement itself needs to include some very specific information. But one of the things that we're often missing is reference to the broad strategy or approach that we actually are using to target the problem. These are the malleable predictors or highly correlated conditions with the issue of poverty, with the issue of teen pregnancy, right? Parent-child interaction therapy, anybody know about that? It's awesome therapy. The therapy is focused on specifically the mediators of increasing parent coping skills, social supports, and positive parenting strategies. These are malleable things. We know that. We can teach people better parenting strategies. If we're aiming to reduce the real big community level problem of child abuse, then these are pathways to do that. Mediators are the indicators that intervening mechanisms that programs target. They are the things we are aimed at, right? I mean, sometimes if we say we're trying to reduce poverty or improve economic conditions, man, you can get all over the map squirrely with that sort of approach, right? I mean, that's a difficult problem. And poverty is on the map this year. I think the Pope's helped with that. They are immediate outcomes most of the time. I think, and as we'll talk about, the farther away we get in the measurement model, the more difficult it is to attribute effects to the program. And that's just a reality of what it is that we do in the work that we do. But generally, mediators are the immediate outcomes that you want to look at. They are constantly measured alongside all of the other outcomes, as well as process measures. And they explain the variance in the outcome. So what I mean by that is if we have a program that looks at reducing recidivism, which is a community level problem, and we are able to show that that program has a significant relationship with the reduction in recidivism for individuals who receive the program versus individuals who do not, what we can see is if the program is what we're really doing is targeting empathy. Let's say we have an intervention that teaches individual offenders, they sit and listen to the stories of victims. There's a whole therapy model around this. It's, and it's been shown to be somewhat effective, but we can see that through this model that we have a significant association of the program with increasing or improving empathy among those individuals. We can see that there's a significant association between the empathy and the outcome of recidivism. In other words, individuals who are high on empathy also are low on recidivism. But what happens when we put all of this in a statistical model together, along with a lot of other things to control for the difference between individuals, is that cancels out, that disappears. And we know that that is a powerful mediator, and that is how we come up with a whole list of proximal outcomes for a variety of community or population level problems. School dropout, we're looking at engagement, bonding, relationships, these things we know matter. School readiness, I love school readiness. This is a place that we need to focus because this makes a difference.
Aaron, I have a question. Going
Yes,
back
sir.
to the previous slide,
Sure.
you're saying that if you do, what do you call your letters, A and B right, C won't matter anymore? Or C
No, C matters. It's what I'm saying is that, and I don't want to get too bogged down in the statistics of it, but when we enter these two variables in a statistical equation along with other individual differences or individual level variables that explain some differences in the outcome, we see a significant relationship between the program and the outcome. And what I'm saying is that when we then enter the mediator into that model, the significant association between the program and the outcome diminishes because the mediator explains the change. Does that make sense to everybody? I'm sorry if I didn't clearly express myself. And please stop me because sometimes I will roll right over the top of things that I'm saying and not pay attention to actually what's coming out of my mouth. I get paid to talk a lot, so. Okay, so let's move on to logic model elements here. Again, I think that most of you are familiar with this process. I will start by saying there is no one right way to build a logic model, and doesn't that feel uncomfortable? But I think there's a common way. I think there's a meaningful way. I think that how we talk about these kinds of conceptual models in research don't make sense for program evaluation. They didn't make sense to me as a principal. They make a little bit more sense to me as a researcher. But I think that I want to talk to you about it in a way that helps with program level evaluation. Inputs. We're really talking about the resources we need to operate a program. All of you are intimately familiar with what those needs are. The activities are really the actions that we are doing to deliver the services that we need. What are we going to do to affect change? The outputs are the units offered. So how much work was done, how many people received access to it. This is not an outcome, but an outcome is really what is the effect of the work that is done. A lot of similar language, but the reason that we put these things in these boxes is we show some if-then relationships. If we provide these outputs, then we see these activities. If we have these activities, then we see the outputs. If we have the outputs, then we see the outcomes. So I'll unpack this just a little bit more. One of the important parts of intervention research is unpacking the black box of what's actually in the intervention, and this is part of the process. Staff and time, contracted services, facilities, technology, collaborative relationships, if that's necessary part of what you're doing. Contracts, if that's also part of what you're doing. I don't think that you have to actually estimate the specific number that you need in the logic model. Brief statements are appropriate. Really, you're going to explain more of the detail in your narrative. The logic model is just a picture to refer to in the narrative, right? But I think that what can also be beneficial about the inputs is actually building your itemized budget, keeping it parallel in nature so that if you list number of staff first in your logic model, that in your budget narrative, that's the first thing you talk about, so that your readers can go back and forth between your budget narrative and your logic model and make sense about what you're talking about. I don't know, I provided a couple of examples here. I think that sometimes we can be too specific. Again, I think that this is more for a budget narrative, the far right column. The middle column is about right. So if we're trying to buy a house, I don't know. I made up some things here, but we don't need to list every single specific financial records, but just that we are going to list the financial records. And then in my budget narrative, I would talk about every single financial record I'm going to get, right? The activities. I like to use verbs here when building these logic models. And if possible, putting an ing on it. I didn't do that here. Making them active. This is what we're doing. And these are really where we start talking about the mediators that are highly associated with the greater problem that we're trying to affect. You got to know the research in your area. I think that sometimes this can be a little bit of a research-oriented issue. But reading some of that research and that literature can help make you familiar with what are the specific malleable indicators associated with the larger problem that you're dealing with. And what are the programs or effective scientific supports that actually work to change those things. So I'll hire a real estate agent, maybe not detailed enough. The middle column there, a little too detailed. Maybe more appropriate for a work plan, which I think is also a benefit of the logic model, is really aligning the activities so that I can develop a work plan, or within my agency I can designate some individuals to work on that. How are we going to do this? Figure it out. The bottom box being just right, just a little bit of information about what it is that we're doing. And again, you're going to explain and expand upon it more in the narrative. And when I say in parallel format, I think that if you put it first in the logic model, talk about it first in the narrative. That is a good grant writing strategy. Winner every time. The outputs. They are the direct byproducts of our activities. It is literally taking off the ing action word from our activities and putting a number in front of the output. And I don't think that we have to be specific here. Like, I don't need to say that I'm going to offer 30 counseling sessions, or that I'm going to hand out 1,500 buddy packs, but that you can count those things. That's the point. This is important because this is really, I think sometimes people overlook the importance of this box right here. This is really where we start getting at program fidelity. I'm not talking about fidelity between you and your spouse. It's fidelity, sticking to the program, sticking to the plan. How well did we stick to the plan? The outputs are evidence of that. If we're seeing that we're not sticking to certain parts of the plan, we can start asking questions about why. That's process evaluation, data-informed process evaluation. I think sometimes we only count the products of program activities. I don't think that's the only thing. It depends upon the service. But when we're providing direct services to individuals, like maybe counseling services, for example, looking at quality indicators is also important. So we've got two aspects of fidelity, quality and quantity. You can take quantity, you can add all of those things up, divide it by the total that you ought to have handed out, or the total number of products that should have been there, and you've got a ratio, you've got a dosage about what exactly it is that, how faithful the program was delivered, a dosage variable or a dosage indicator. Sometimes this is helpful because when we put all this information, we try to analyze this information in a spreadsheet. Some people get more of the program than others, right? Some people access food bank more than others. We may be able to look and actually see that those individuals who are accessing food bank more than others are having some successful outcomes. But if we try to aggregate them all together and we only see that one or two individuals access it per year, and we're turning in an annual report, those individuals may wash out the effect of the other individuals. So it's important to look at dosage. What about the quality indicators? It's important to look at that as well. That has a major impact, particularly around like human-to-human services, counseling and other sorts of services like that. Looking at engagement. How, are certain individuals more engaged, or do they have a better bond with the counselor than others? They're going to have a better experience, guarantee it. A little bit more on the quantity and the quality. I think that if we are, one of the things about that we don't do very often in program evaluation is if we're comparing status A to status B, we've got to make sure that we know well enough what was happening in both conditions. Otherwise, what happens in research a lot, especially randomized trials with social interventions, this is what I love about a lot of research. We don't often, we have a randomized controlled trial and we put some students over here and we put some students over there and we give an intervention to these kids and we say they got services as usual. Well, what the heck does that mean? I mean, what are we actually comparing this group? What are we comparing? If we're not monitoring actually what's going on over here and what's going on over here, if we only pay attention to the treatment group, but then we've got this other group that's just kind of hanging out over there, they got services as usual. I mean, we can't really directly make a comparison, but it gets glossed over every time. I think this is also true for baseline. Most of you are doing single subject or single system designs. You're not engaging in randomized trials, I would guess. Maybe you're comparing one group against another within your agency, possibly if you're trying to implement a new service and you want to see, is this service effective? Let's compare it to, our services as usual. Make sure you monitor that. But that if you are using a single system design, which is what most program evaluations are doing, that you're really paying attention to what's happening at baseline as best as possible. And then, as I mentioned, estimating the fidelity, comparing compliers with non-compliers, or what I call intent to treat, which is lumping everybody in and saying they got the same, to treatment of the treated, which is using that dosage variable to try to tease out whether there's an effect dependent upon the level of access. Outcomes are really the measurable benefits that we really want to target. And ultimately, you like that? I like that. We see them as short-term, proximal, or immediate. I mean, these are all terms that are used to describe those very first changes that we would expect to see. We're really talking about knowledge, attitudes. We're talking about cognitions, possibly, if we're engaging in counseling or other kinds of cognitive reforming interventions. These should link logically to interim or medial or intermediate outcomes. This is what we're talking about when we see skills and behaviors and social interactions. A lot of folks, and even in textbooks, talk about skills being a proximal outcome. I would challenge that. Think about what it takes to build a skill. It takes time. You need the knowledge first, right? Then you need to engage or practice in offering the skill. And you need the feedback. And eventually the skill develops. But you don't just get a skill because you get an intervention. You know, I don't understand skills as being proximal, so I think they're more medial. These link to long-term distal or impact outcomes. These are the terminal changes that we hope to achieve. A lot of times we're engaged in measuring these things on the individual level, but really when we persist on these things and we look at it over time, conceptually speaking, we could see community level change over 7 to 10 years, depending upon how long we actually measure it, how well we're able to measure it. But as I mentioned earlier, the farther we go out in this process, the less attributable these outcomes are to the actual program that we're offering, right? It's kind of hard to make the link. But if we can do it developmentally over time and actually show these things can link, we can actually make an argument, a valuable argument. There's lots of error in those arguments, but that's okay. We're dealing with human beings, and there's lots of gray area and all of that. So an example, developmental impact of immunization PSAs. Anybody remember a couple of years back, some British researcher had a group of 12 kids with autism that were on the autism spectrum, and he released this ridiculous report where he fabricated some information, and the English media caught up with this, and it hit the world stage, and we still have parents that don't want to immunize their children against child-borne illnesses. So, you know, we've had PSAs over the past few years trying to get back to where we are. We've got public health issues because this one knucklehead with a sample size of 12 affected a major health intervention. It's incredible. Anyway, but really thinking about how this PSA process links over time in changing knowledge, behavior, and the eventual condition, I think is a good example. I don't know if maybe some of you can think about your own programs in the same kind of fashion, but reducing the myths and increasing the knowledge of access, where I can get these immunizations, certainly makes sense to link to increased number of parents taking their children, reporting positive bonds or positive attitudes about immunization and healthcare providers, which ultimately will result in fewer kids having dangerous conditions and better overall health. One way to think about these in the logic model format, one thing I do for grants a lot is I will put similar numbers, because this idea conceptually links to that idea, and we're going to have multiple ideas. Do not have just 1 or 2 or 3 outcomes, proximal outcomes. You're going to have multiple proximal outcomes because you need to evaluate your programs on multiple indicators of success. Some you're not going to detect change on, and some you will. Don't have one. I'm telling you, it's not a winning strategy. So thinking about linking those across the boxes using a number letter system, some way of linking them across will help communicate your ideas as well in grants. The outputs versus outcomes argument, I think these things are often conflated. And so I just kind of put this table up here just to suggest, the number of people who showed up here today is an output. The length of time I drone on about this issue is an output. But the change in knowledge that I hope to see is an outcome, right? No hands raised, so I don't need to drone on that. You were going to say something, though, weren't you?
Yeah, you always hit me with the previous slide. I really want to just process
Yeah.
it. You're saying that we should have multiple levels. For some of us that are beginning, we were told we should have one thing we're focusing on. And so it's like several schools of thoughts clashing inside my head because on the same time, I don't want to fabricate anything that we cannot do. At the same time, I don't want to be reaching for what I think is something, but really is not pertinent to what our program really does. And so I know I'm not the only one that had that light bulb go off, but I'm not afraid to say it.
I'm glad.
So I don't want to be safe, but at the same time, what's realistic for what we're trying to do with United Way from your perspective on seeing that you saw 19 proposals? Because going after multiple outcomes may not be the answer for some of the smaller grassroots organizations, whereas some of the big boys that are in the room may be able to dive down to that level where they have multiple years because they've been doing it for 30 years, whereas some of us only been doing it for 2 to 5 years. And that's hard to put you on the spot.
No, I don't. I like being put on the spot. And I want my ideas to be challenged for sure. I don't think I have all the answers, but I will say that I disagree with you, that I think that even the small guys and the small interventions that you're offering you're targeting multiple problem. Well, let's see, I'm not focused on the problem necessarily so much as it is that I am saying you need to look at what is the possible change that we can affect. Sitting down and listing all of the things that if I offer my service to whoever is receiving it, what are all of the possible outcomes that I could list that might change? And then I think you can begin to develop that across sequence. And I agree with you that it feels like reaching out long term is just like, is this realistic? And I think you have to be realistic. But if you're small time, you've only been operating for a few years, yeah, given it time, if you can probe some of those individuals who received your program, 10 years down the road and compare them to maybe a similar situation or set of folks who didn't, I'd say you might have an argument for saying that we made a long-term impact in these people's lives.
So from what you just told me, don't be afraid of reaching. That's all I need to do.
Well, I hear that. Yeah, no, absolutely. I think that we can't be afraid of reaching. We can't be afraid of this process. I don't think that this is rocket science to any of you. I think it's just trying to boil it down into its essence. But yeah, I think that, and certainly, the bigger the program, the more power that sometimes folks have. They're offering different services. They might have different levels of outcomes that they're looking at, but you have to really just focus on what the activities are that you're doing and what are the possible changes that you can conceive of. And then we'll move on to measurement. And that's going to be the focus of the next module, really. That's where we'll really start hitting the road. Thanks for that.
No problem.
Why am I going backwards? Oh. Okay. And I don't need to drone on about that anymore. Okay. How am I doing on time? It's 10 o'clock. Okay, we got 30 minutes. I included a couple of logic models here. One is from Bicycle Helmet Public Information Policy. I wanted to include this one because interventions are programs, are also policies, whether at the state or community level. It's an intervention. It's a set of statements or ideas designed to change or alter something. I'm going to share with you a single program logic model, and then we'll break into a multimodal program logic model as well. So some genius figured out how many head injuries that kids were having from bicycle accidents about 15 years ago. He was a graduate student at Harvard, and he came up with this idea that we need to affect a policy about wearing bicycle helmets. This guy, within the space of about 5 years, completely changed our public attitude about wearing helmets for kids, and he did it effectively. Through a PSA and other avenues as well, but it's an effective program, and today we have way fewer traumatic brain injuries because of the work that he did. Pretty cool. This is a program that I developed. This is more of a research-oriented conceptual model where I'm suggesting that my program offers specific educational activities that target specific malleable indicators of behavioral problems in schools, where I'm suggesting the, I would say, intermediate outcome is improved classroom behavior and increased social emotional learning, but that the distal outcome is really the changed condition of a student being able to learn more. I mean, if we've got more time, this reciprocal feedback process of teaching kids in the classroom and they're on task, they're going to learn more. This is a multi-level or multimodal logic model. So basically, I think the idea here, and it's pretty simple, so for agencies that are providing multiple services that are clearly distinct from one another, building an individual logic model around each one of those services and then inserting it into a parent model is basically the idea. So for each one of these strategies, we would have an individual logic model. That would look, I mean, and this is again, they are different from the ones that I'm suggesting, which are the inputs, the activities, the outputs, and the outcomes. And I'm telling you, this is the way SAMHSA has conceptualized this process. I don't think there's any one way to do it. So I threw these in here just to confuse you. But some of the basic elements are still there. I like the inputs, the activities, outputs. I think it's the most clearly defined example out there. But so there are a couple of strategies under that parent model right here that relate back to that parent model. So that's just the basic idea. It's not, you know, they're just nested. Not real complex stuff. So we didn't cover everything we need to know today, but there's a resource guide on there and a way of thinking about how you might take your program and back up and write a logic model around it. Who in here actually already has one? I know some of you do. Working on it.
Not confident. It's like that.
Okay.
You know, we have one, but at the same time, always looking for improvement.
Absolutely. I think that's what this is about, really. It's about how we can continually develop a process, an outcomes evaluation process to improve what it is that we do. How well is some of this mapping onto your logic model in terms of what I'm saying? Awesome. So she's gonna provide example for everybody. My test is a grandmother test. If I can hand this to my grandma and she can say, yeah, I get what you're doing, then that's, I think, the bottom line. Because we want to be able to use it, put it up on our website, hand it out to individuals in a pamphlet. Here's what we do. You know, we do some complex stuff, but I think the logic model really lays out the picture of what it is that we're doing. Cautionary word on outcome linkages and causality. Of course, I mentioned requirements for causality are temporal ordering. So the intervention must come before the outcome is measured. You can't do it in reverse and say that one caused the other. We need the association. We need significant change in the outcome associated with receiving or accessing the intervention or the dosage of the intervention. And we need to counterfactually rule out other causes, which is the idea of program design. It's difficult with single system, not impossible. Not impossible. We'll talk more about that in the other modules. But the farther away we get from our intervention, the harder it is to attribute change to the intervention. That's just a reality. I think you should keep this practical. It really should be for your agency. First and foremost, it should be thought of as a way to start the process of quality assurance. That ultimately, I think that process evaluation gets downplayed sometimes for outcomes evaluation. We want to know the outcome. That's where the money is, right? But sometimes there are things going on with the process that if we aren't collecting data around the process, those outputs, and monitoring the activities, we'll have problems. And we may not see the outcome. It might be that your program is effective and that you've got 10 out of your 20 counselors who aren't actually implementing it properly. Well, what's the issue there? And do we need to retrain? So these are kind of questions that we want to answer with process evaluation. I think it gets often cast to the side. I think estimating a cost-effect size ratio is also a possibility of looking at really estimating the process as well as the outcomes. You know, can we actually get the same bang for our buck? Well, maybe with less buck. Are there processes in what we do that are not as effective as others? That make sense? If we can cut some fat, then let's do it. So that's just part of the feedback process that can help inform program evaluation and decision making. And using explicit language in these models, never assume your reader knows. You know what they say about assume, right? It makes an ass out of you and me. Use action words to describe the activities, and parallel construction between your logic model and your budget narrative, your intervention narrative, will help to increase the clarity of what it is you're trying to say in a funding proposal. So we've got a little bit of time. I don't know if we're going to have enough time to get through all of this. I wonder if maybe at each table, if you guys would be willing to take one program, you guys decide who that is, and maybe just start in on scratching out a logic model. You've already got one. Maybe somebody else has one. Maybe you want to share it and maybe try to help somebody build another, build a logic model around their program who doesn't have one. There's a tip sheet in there on walking through that. If we could maybe just spend a few minutes kind of doing that, and then we'll try to share a little bit about maybe some complications. And if you're having questions, holler at me. I'll come around. Let's just talk about real quick questions or concerns you have with this kind of thinking. Questions or concerns you have with this kind of thinking.
How do you prove a negative?
How do you prove a negative? How do you prove the counterfactual?
Yeah.
Well, that is the problem that we all deal with in research. How do you prove the counterfactual? The counterfactual is if I did not give access to the service, what would have happened? In single system or single subject design, the counterfactual is really attributed to the difference between the baseline functioning and the post-test functioning. It's about as strong as we can make it. Now, between groups designs, where you have one comparison group, like in a social service agency, you wouldn't be randomizing necessarily, possibly, but you might have some similarly situated individuals in two groups. We can look at the measures between those two individuals, and the independent variable of the program is the thing we manipulate that explains the difference. So that's the counterfactual there. I know you all love the Dolly Parton Imagination Library program. Yes. So I did a little bit of evaluation project on that recently, where I had just parents that were receiving access to the program, and Jolene actually, developed a propensity score model to identify children in Columbia Public Schools that were similar demographically speaking, and so we can capture individuals that are similar to that group. So that helps us prove a counterfactual there without actually having, we get the comparison group later. So, there are ways to do this stuff, but I'm not saying it's all right. And here's the thing, just because we get one evaluation doesn't mean that we've got causal claim to say that, give me the Nobel Prize. What we've got is a series of evaluations over time that we can say, you know what, I see a pattern here, this is effective. What we're doing is effective. And you're also using that information to make decisions about, this is not working, and we need to change that. So the mid-course corrections.
I would just add, too, that if you're using evidence-based strategy, you can let other people do the work.
I think that's true, and I'm going to talk about that next time, and resources to find evidence-based programs, strategies, and practices. If your agency is serving a particular purpose, where can I go find some of this information? There are government clearinghouses and independent resources for those things out there, and the legwork has largely been done for you. So. Yes?
How do we find something that's along that line, but in plain English? Because sometimes it's the technical jargon of the particular arena that you may be in, and so you almost have to learn a new language, and then you have to translate that for yourself, and then translate that again to your staff. So how do we find like the ABCs of the doctoral program?
Well said.
There's probably a book on that. I didn't look that one up. I think that a couple of the resources that I put on that handout, I think are super helpful. The RAND Corporation documents are really good. When we're talking, you know, evidence-based is such a loaded word, and it means such different things to different people. What I argue as being evidence-based is really what I ground in practice, because that's what you all are doing. Now, we can say that a program or a practice or a set of practices is evidence-based, is shown by research, and, you know, What Works Clearinghouse can put it up on their website and give you some citations and studies that have looked at it. But I don't, you know, and I think that that's worth knowing about at your level if you're providing those kinds of services. But when I talk about practice, I'm really saying that you are using performance measurement to look at how individuals are functioning before they receive access to your treatment, and are they better off when they leave. That is evidence-based to me. That matters. You know, you don't need some fancy researcher to tell you that what you're doing makes a difference, but you need to establish it on your own, and you need to do it in a conceptually relevant and watertight way. That makes sense. I mean, I think we're living in the age of performance enhancement or performance measurement. Don't get me wrong. Coming from education, we've done a lot of things in education that are not evidence-based. In fact, most of what we do in education is not evidence-based, sadly. And, you know, No Child Left Behind has not helped our schools. And you talk about the biggest piece of performance measurement ever come down the pipeline. But I think that what I really see this as is a tool for me as a director or a social service provider to evaluate my client, to aggregate multiple clients up to the agency level and look at how I'm doing over and across the board when it comes to those individuals. And I think if we plan for that, we can do it. Any other concerns about this kind of thinking? Because I'm with you. Y'all got stuff to do. I mean, when I ran a school building, I was managing staff, I was managing parents, I was managing students, I was cleaning out my own closets, and I got to write a grant, and I got to measure stuff too. I mean, you know, I know it's a lot to think about. I think that if we can plan and do it right, that it's not, you know, that it's doable. But I understand
the other important point is, you know, as we made the move in United Way to community impact, we're learning this as we go. And I think that's the most important thing as we move forward, especially with the other models here, or modules, is that together we can learn how to do this in a very effective way that will benefit all of us and strengthen all the individual programs, as well as frame a story that we can tell to donors and the general public about why what we do is so incredibly valuable in this community for the people that we serve.
Recent polls show that donors are not giving as much these days, and we all know why. But people will give if they know their money's going to be used effectively. They will. And if you can demonstrate that, it makes a difference.
It's so true even of ourselves. I mean, in the word that gets out there even in the community. I can give you a perfect example. Recently I was at one of the little social groups that I belong to, and we were it was amazing how heated the conversation got, because some of us wanted to give to a local specific thing, and some of us had heard that they had a little bit too much money right now, and our funds are very limited, and I couldn't believe how heated it got. And it's so important that people do know that we're making a difference with what we do, and that word in the community is out there for us.
Yeah, we start picking winners and losers when the budget gets tight.
Yeah.
And you know who the losers are. It's people that you are providing services for. These are the folks who are down, you know, have had trouble in life. They're struggling. They're not highly valued in our society, even though we pay a lot of tribute to it in political speeches and otherwise. But the reality is, I'll stick around for a little bit if you want to, drill me a little bit on my thinking. Feel free. I just want to say thank you. My wife and I, we moved here a couple of years ago, and we moved here specifically because I saw opportunities like this. I do not want to be an ivory tower researcher that sits up there in my computer and types up papers so that 5 people will read them. This is what I value right here, and I hope that, take my information. Please feel free to contact me. I'm totally down with coming out and working with you. Totally down with it. And, I think that, the kinds of things we're trying to achieve here, take community, and man, what I see here, my skin is crawling. I'm excited. So I just thank you. Thank you.